A few months ago, I met a patient. Let's call her Sarah. She was in her early 60s, sharp, active, full of energy, the kind of person who doesn't sit still for long. But for the last several years, her knees had made that impossible. Every step felt like walking on sandpaper. She had done everything right: injections, therapy, supplements, braces, and now it's time for knee replacement. She was ready, except for one thing. She looks at me and she says, "Dr. Goldberg, I need to ask you something before we go any further. I can't wear earrings. Every time I try, my ears swell up and they itch like crazy. I think I'm allergic to metal. Does that mean I can't have a knee replacement?" That question stopped her cold, and it's one that I've heard many times before. If you've ever had a rash from a watch band, irritation from jewelry, or redness around buttons or belts, you might have wondered the same thing. What if my body rejects an implant? What if I'm allergic to what's inside it? So today, let's talk about that. Because if you're someone who needs a knee replacement but who has concerns about metal allergy, there are solutions just for you. They're real ones, and I want you to understand what they are, how they work, and what you should know before making that next step. Let's start with what is really going on. In most cases, when people say they're allergic to metal, what they're really referring to is the sensitivity, most commonly to the metal nickel. Nickel is one of the most frequent contact allergens in the world. It's in everything from jewelry to coins to your phone. And if you've ever worn a pair of earrings and noticed itching, redness, or irritation, that's your body telling you it doesn't like that exposure. That's why this comes up in joint replacement, because most traditional knee implants are made of metal alloys that contain small amounts of nickel, cobalt, and chromium. For most patients, this is not an issue at all. These metals are extremely stable, they're biocompatible, and they've been used safely for decades. But for a very small percentage of people, especially those with strong history of metal sensitivity, it's worth paying attention to. Here's where it gets a little tricky, and this is something even within the orthopedic circles that I work in, we still debate. True implant-related metal allergy is very rare, exceedingly rare. The science tells us that while thousands of people have skin sensitivities to nickel, only a small fraction of those will ever have a reaction deep in the body after a joint replacement. That means that you can have skin sensitivity, but no deep metal allergy. That's because the way your skin reacts to metal and the way your immune system interacts with a buried implant are two entirely different things. On the surface, nickel can oxidize and trigger a local rash. Inside your body, that same material is protected and doesn't necessarily release the particles or ions in the same way. But, and this is important, for a small group of patients who truly are hypersensitive, even a trace exposure can create discomfort, swelling, or inflammation that feels almost impossible to explain. And sometimes that reaction doesn't really show up right away. It can be weeks or even months after surgery when a patient is still experiencing pain or irritation and everything else looks normal. No infection, no mechanical loosening, no problem, just pain. That's when we start to suspect it might be a metal hypersensitivity issue. So, is it common? No. Is it real? Probably yes. And if you're one of those people, it's absolutely something we can work around. So, how do you know if you're in that group? If you've had visible allergic reactions to jewelry, watches, or metal snap, it's worth mentioning to your surgeon. That's a strong indicator that you could be sensitive to nickel or related metals. Some patients even remember having allergy tests or patch testing years ago that confirmed it. Others just know because they can't wear certain types of things or metals without a rash. Now, should everyone go get tested for metal allergy before surgery? Not necessarily. Most research suggests that routine allergy testing isn't required unless you have a strong history of reaction. Why? Because the test, whether skin patch or blood-based, can sometimes overdiagnose the issue. You might test positive, but never really have real symptoms once your implant is in. Now, there are commercially available analysis kits that can diagnose you whether or not you have a metal sensitivity or not. We can do these for you. They're costly, but the smarter approach is to take a personal history seriously, weigh the risks, and plan your surgery accordingly. The solution to me is hypoallergenic knee implants. Now, here's the good news, and this is what I tell every patient who has that concern. If you do have a known allergy or even a high suspicion, we have options. They're called hypoallergenic implants. These implants are specifically designed for patients who can't tolerate nickel or other metals. They look, move, and function exactly like a standard implant, but they're made with a different material or coating that can dramatically reduce your exposure to any allergenic metal. Some are made entirely of titanium, some are oxidized zirconium, which is highly biocompatible and non-reactive. Others will use a standard metal component but apply a protective coating like a titanium nitride or ceramic layer around them, and that will prevent metal ions from ever contacting your tissue. The goal is simple: keep all the engineering and precision and longevity of the implant while eliminating the risk of allergic irritation. And when you look at the results, patients with these hypoallergenic options do very well. Their recovery, their motion, and their long-term success are equivalent to traditional implants, but they have peace of mind knowing their specific sensitivity has been addressed. I want you to understand something about these designs. They're not experimental. They're rigorously tested, FDA-approved devices that have gone through the same scrutiny as every other implant I use. The difference isn't in the mechanics, it's in the surface chemistry. For example, an implant made of oxidized zirconium has a ceramic surface that's incredibly smooth and durable, while the interior still has a strength of metal. It's the best sort of both worlds, if you will. In other cases, coatings like titanium nitride create a thin golden layer that acts like armor, blocking nickel or cobalt ions from ever leaching out. As a surgeon, my priority is to match you with the right implant for your body, your activity level, and your goals. If metal sensitivity is a part of your story, we plan for that from the very beginning. Even with the right implant, surgery is still surgery. You still have recovery, therapy, and a period of rebuilding strength. And even in rare cases, some patients might experience discomfort that has nothing to do with the implant material at all. It could be muscle tightness, swelling, normal healing type stuff. That's why communication matters so much. When I work with patients who have allergies, we talk about everything from their past reactions to their current environment, and even from nutrition to supplements. It's about minimizing risk and maximizing clarity. If you've ever had issues with metal before, don't keep that to yourself. Bring it up early so we can plan intelligently. I always remind myself, a successful surgery isn't just about fixing a joint, it's about restoring trust in your body. That's why the conversation about allergy, materials, and customization fits perfectly into how we define value in medicine, not as a one-size-fits-all formula, but as a personal equation built around you. For some patients, value means precision. For others, it's safety and peace of mind. For others still, it's knowing their surgery won't trigger a hidden sensitivity that could have been avoided. My goal is to eliminate the unknowns so you can walk into surgery confident, not anxious about what's going on inside your body. So if you've been putting off knee replacement because of a fear of metal allergy, don't let that stop you from getting your life back. Modern technology has evolved to give you options that are both safe and effective. You can have a knee that moves smoothly, feels strong, and works without pain, without worrying about what it's made of. Talk to your surgeon, ask about implant materials, and if you have a history of allergies, make sure that that's a part of your pre-op plan. It's a small conversation that can make a big difference. And if you want to learn more, I've included a link below that walks you through the different hypoallergenic options available today, so you can compare them and ask yourself in an informed way for your next appointment. At the end of the day, my goal is to give you clarity, not confusion, because when you understand your options, you can move forward with confidence. If you've been told you need a knee replacement and you're worried about allergies, you're not alone, and there's absolutely a path forward. I'm Dr. Tyler Goldberg, and every week on this channel, we explore real questions from real patients so you can make the best decisions about your health. If this was helpful, subscribe for more clarity-driven education, and share the video with someone who's been delaying surgery because of fear or uncertainty. Because the truth is, the right implant in the right hands changes everything. And I'll see you in the next video.